You feel different. Tired maybe. Emotional. A weird cramp here, a strange craving there. And then the thought hits you, could I be pregnant? I've been there, and so have thousands of my patients. And as a doctor and as a mom, I can tell you, your body knows. Sometimes long before a test does. Today, I'll walk you through the real early pregnancy symptoms, what you may notice as early as week 1 or 2, even before a positive test. We'll talk about what's normal, what's surprising, and what most people miss completely. This video is for you if you're trying to conceive, if you're anxiously waiting, or if you're just curious what early signs to watch for. Let's start at the very beginning. What actually happens in week 1 and 2 of pregnancy? Here's something important. In medical terms, pregnancy starts on the first day of your last period, even though you're not technically pregnant yet. So week 1 is your menstrual week. Week 2 is when ovulation happens, typically around day 14 in a 28-day cycle. If conception occurs, the fertilized egg begins its journey down the fallopian tube and implants around 6 to 10 days later. And that's when the real magic and symptoms begin. So let's talk about what those early signs actually feel like. Symptom number 1. Implantation cramping or light bleeding. One of the earliest signs women notice is a very mild cramp, almost like PMS, or a small spot of blood. This happens when the fertilized egg implants into the uterine wall. It's called implantation bleeding, and it usually shows up 5 to 10 days after ovulation. It's not a full period. It's light pink or brown. Just a few drops, maybe a day or two, and then gone. So if your period seems weirdly short or off, it might not be your period at all. Symptom number 2. A sudden wave of fatigue. I always say, if you feel like you've been hit by a train, and you've barely done anything today, that's a sign. This isn't normal tiredness. This is hormonal fatigue, caused by a rapid rise in progesterone, which prepares your body to support a baby. Even before a test turns positive, your body is working overtime, growing tissue, adjusting blood flow, even beginning to form the placenta. So if you're suddenly needing naps, sleeping longer, or feeling exhausted for no reason, don't ignore it. Symptom number 3. Breast changes. This one is huge and often one of the first things women notice. Within days after conception, many women feel soreness, tingling, heaviness, darkening of the nipples or areolas. Your breast tissue is extremely hormone sensitive, and estrogen, progesterone, and HCG are already rising fast. I had one patient who said, I knew I was pregnant because my bra suddenly felt like a torture device. And yes, that can happen as early as week 2. Symptom number 4. Emotional sensitivity or mood swings. Suddenly crying at commercials? Snapping at your partner, even though they didn't do anything? Blame the hormones. These early shifts, especially in estrogen and progesterone, can create emotional highs and lows that feel like PMS, but stronger and more persistent. It's not in your head. It's chemical, and very common in the first 2 weeks post-conception. Symptom number 5. Heightened smell or strange tastes. You walk past someone's perfume and want to gag. Coffee smells weird. You suddenly can't stand your favorite food. This is real. It's called hyperosmia, an enhanced sense of smell, caused by the same hormones that help your body detect toxins and protect the baby from harmful substances. I've seen women realize they're pregnant just from their nose. And along with that comes metallic taste, food aversions, and sometimes the beginning of nausea. Symptom number 6. Bloating or feeling full in your lower belly. Even though the embryo is microscopic, many women report feeling strangely bloated, especially at night. It's not from the baby's size. It's the slow digestion caused by progesterone. Your body is already shifting. Your uterus is getting more blood flow. And yes, you can feel it. This is especially common in second pregnancies, when your body remembers. Symptom number 7. Frequent urination. It's early, but some women feel it even before a missed period. That urge to pee more often comes from increased blood flow to your kidneys and pelvic organs. And it doesn't mean you're imagining things. Your kidneys are already filtering more fluid to prepare for pregnancy. Let's pause here. If you're watching this and checking every box, you're probably feeling two things: excitement and anxiety. That's normal. This waiting phase is emotionally intense, especially if you've been trying for a while. But I want to tell you something important. Trust your body. Even before a test can detect HCG, your body is already responding. And you don't have to wait and see in the dark. Start tracking your symptoms. Keep a journal. Tune in. And most importantly, be gentle with yourself. Quick tips while waiting for your positive test. Avoid alcohol completely. Switch to prenatal vitamins with folic acid. Eat nutrient-rich whole foods. Get good sleep. Don't over-exercise. Keep movement light and nurturing. And reduce caffeine if possible. You're already in it. You're already nurturing life, even if it hasn't been confirmed yet. Let's recap the early signs of pregnancy in week 1 and 2. Light spotting or cramping. Sudden unexplained fatigue. Sore or heavy breasts. Emotional sensitivity or mood swings. Heightened smell or weird taste. Bloating or a full lower belly. Peeing more often. Not everyone feels all of these. Some women feel just one. Some feel nothing, and that's okay too. Every body is different. But if you do feel these, listen. Here's your next step. Take a test around 12 to 14 days after ovulation. If you're not sure when that was, count from the first day of your last period. Most early detection tests are accurate a few days before your missed period, but testing too early can lead to confusion. If it's negative and your symptoms continue, wait 2 to 3 days and try again. And whatever happens, you are not alone. If you found this helpful, please like the video, leave a comment sharing your symptoms, and subscribe for more pregnancy insights from a doctor who's walked this journey too. Let's support each other with science, compassion, and truth. Your body is wise. Your intuition matters. And the earliest signs of life are already whispering to you.